With the ER crisis in Edmonton, students at the University of Alberta developed an initiative to treat unhoused people in the city
and alleviate the strain on our current healthcare system.
Greet them and treat them. That is a goal of more than 10 students of the Student Advocates for Public Health, or SAPH, that aim to create a healthcare facility that welcomes homeless people and be equally treated. Something that Brian Kenny, who has experienced homelessness for over 20 years, would love to see, as he experienced a gap in the healthcare support system.
There was a particular hospital I went to in 2003. I was suffering from a mild heart condition that I have. And I literally heard the nurse tell her other worker, he's one of those people, let's get him out of here. I felt very, very judged, very mad.
And this is how we came up with this idea, to make sure that there's a non-judgmental and unbiased atmosphere for the patient.
According to SAPH research, 77% of the unhoused population in Edmonton are using the emergency services, with more than 9,000 patients being treated in Royal Alex Hospital alone. But adding this facility as an expansion of a hospital or an existing building will save resources, according to Muscan Kang.
We will reduce patients going in and out and cycling, so it will save resources in the long run, as Imrose mentioned, because patients will leave with a tailored care plan. They won't just leave with uncertainty or question what's their next move.
The project is a continuation of their bridge healing program. Dr. Louis Francis Cuddy says by adding the ICU, it will result in a 75 to 80% reduction in ER returns.
Patients don't need to come back to emergency because they either get permanently housed or they go on to educate. Like we had some people come and stay with us for 60 days and now they're nursing students.
The project is still a proof of concept. Bridge Healing Program is already supported by the municipal and provincial governments, and these students are hoping for additional funding from Ottawa to further develop the new program. In Edmonton, Leo Cruzat, City News.